Root canals are a common dental procedure that may be necessary when the pulp inside a tooth becomes infected or damaged. While root canals can be an effective way to save a tooth and alleviate pain, they are not always the best option for every patient. In some cases, there may be alternative treatments that can achieve the same results without the need for a root canal. In this video, we will explore some of the alternatives to a root canal and discuss when they may be appropriate. 1. Monitoring and reevaluation. One alternative to a root canal is simply to monitor the affected tooth and reevaluate the situation over time. In some cases, a tooth may become infected or damaged, but the infection may not progress or the damage may not worsen. By closely monitoring the tooth and regularly checking for any changes, a dentist may be able to avoid the need for a root canal. This approach is often used when the infection or damage is not severe and there is a chance that the tooth may heal on its own. However, it is important to note that this approach carries some risks, as the infection or damage could worsen over time and lead to more serious complications. 2. Medications. In some cases, a tooth infection may be treated with antibiotics or other medications instead of a root canal. Antibiotics can help to combat the infection and reduce inflammation, allowing the body to heal the damaged tissue inside the tooth. While medications can be an effective alternative to a root canal in some cases, they are not always sufficient to treat a tooth infection. Infections that have spread to the root of the tooth or that have caused significant damage may still require a root canal to fully address the problem. 3. Pulpotomy. A pulpotomy is a procedure that involves removing the infected or damaged pulp tissue from the crown of the tooth while leaving the healthy pulp in the root intact. This can be a less invasive alternative to a root canal, as it only treats the affected portion of the tooth. Pulpotomies are often performed on baby teeth or on permanent teeth with immature roots. In some cases, a pulpotomy can be an effective way to save the tooth and prevent the need for a full root canal treatment. 4. Pulp capping. Pulp capping is a procedure that involves covering the exposed pulp inside the tooth with a protective material, such as a dental sealant or a medicated dressing. This can help to protect the pulp from further damage and infection, allowing the tooth to heal on its own. Pulp capping is often used in cases where the pulp is only slightly exposed or where the damage is not severe. While pulp capping can be an effective alternative to a root canal in some cases, it is not always successful and may not be able to fully address the underlying issue. 5. Extraction. In some cases, the best alternative to a root canal may be to extract the affected tooth altogether. While this may seem like a drastic measure, it can sometimes be the most effective way to resolve a severe infection or damage to the tooth. Extractions may be necessary when a tooth is too damaged to be saved with a root canal, or when the infection has spread to the surrounding teeth or bone. While losing a tooth can be a significant inconvenience, it may also be necessary to prevent further complications and maintain overall oral health. In conclusion, root canals are a common dental procedure that can be highly effective in saving a tooth and relieving pain. However, they are not always the best option for every patient. There are several alternatives to a root canal that may be appropriate depending on the severity of the infection or damage, including monitoring and reevaluation, medications, pulpotomies, pulp capping, and extractions. If you are considering a root canal or are unsure about the best treatment option for your dental issue, it is important to consult with a qualified dentist who can provide you with personalized advice and guidance. By exploring all of your options and weighing the potential risks and benefits of each, you can make an informed decision about the best course of action for your oral health.